Primary gravida, 32 weeks gestational age. I have scanned all of it. Now, this is the head, it's normal. The vertebral column seen is normal. Cephalic part and the caudal region. The kidney is normal. See the kidney? Now this is the kidney. This area is the kidney, aorta. Now, as I will move towards the abdomen, you will note this is the thorax. You can see the heart. This is the heart. Yes, sir. And now in longitudinal section, you will see cystic areas, longitudinal, tubular as well as globular, and they will see movements within it. As well as you will see echoes, these floating echoes in few of these segments. Now these are the floating echoes in this one. Note the floating of the echoes. And the peristaltic movement, as well as all of these are the dilated bowel segments. Let's measure this one. In transverse section, anything above 18 is considered to be of pathology of significance. They say even in the longitudinal section we should also measure any one segment, and let's measure this one. It's 51 and is significantly dilated. Now these cystic areas with internal equal movements within them are seen extending towards the lower abdomen from the upper abdomen. That is the liver. This area is the liver, and these you remain concentrated on these tubular structures and these cystic areas with the mucosa changing its shape. You see, this is the mucosa, submucosal line. Now, having seen this, this is the upper abdomen, and now I'm going to show you the lower abdomen. Now you see it's a female patient, it's a female, double X. You will see two lips. This one. Now these are the labia. It's a female fetus, and here you see all the bowel segments are seen distended from the in all of the abdomen. There is no polyhydramnios. The amniotic fluid is normal. This is the single largest amniotic fluid pocket. It's normal, mild, measure it, it's normal. Neither it's oligohydramnios, neither it's polyhydramnios. In case of colonic pathologies or at the lower pathology at the lower end of the intestine, we do not see these cystic areas or the bowels distended up to the upper abdomen, starting from the lower abdomen. This is the lower abdomen. In case of now, remember one thing: this is not the bowel. These are dilated bowels. This is not the bowel because we are seeing it at the lowermost part of the abdomen. And let's give it some blood, and you will see the umbilical arteries at both ends. These one. This is the urinary bladder. We saw the kidneys are normal. This is the transverse of the abdomen. There had been polyhydramnios if there had been a chronic pathology or lower digestive tract anomaly. So this is, and no dot sign is seen near the genital area, dilated cystic area with the dot in it. So anal atresia is ruled out. And this is a case of dilated bowel segments in a 32 weeks fetus, the cause of which is very difficult, in fact, to define to evaluate through ultrasound. However, it can be a volvulus, it can be a iliac region or jejunal region obstruction. So this is our case of the day with distended abdominal bowel. Measurements I have given you. So it may be an obstruction, abdominal obstruction. Sorry, intestinal obstruction. Case of the day. Thank you very much.